If we think of Amsterdam today, we think of red lights, freedom, crowds, and maybe sometimes too much freedom and too many crowds. But Amsterdam haven't always been this postcard for freedom and safety. In the 1970s, the streets of this city, my city, looked very different. We weren't stumbling over suitcases or sidestepping selfie sticks. We were avoiding heroin junkies. Not on some hidden corner, but right in the heart of the center. Entire neighborhoods, especially the red light district, became places you rather avoid. Young people were lost to addiction, and families were torn apart. And the city itself was disrupted and unstable. And in these years, the coffee shop took shape. Not as an experiment in lifestyle, but as a deliberate strategy to separate the markets, to keep young people away from hard drugs. But it wasn't easy in the early days. Coffee shops were under constant pressure. Raids, checks. Staff and visitors treated like they were criminals. But the model endured. Why? Because it worked. Because it solved a problem. And the government understood that. This year, we mark a double anniversary. Amsterdam celebrates its 750th birthday. But at the same time, we mark 50 years of coffee shop policy. 2 milestones that show that this city have always managed to reinvent itself. I'm 36, so the coffee shops are here longer than I have. And for me, the coffee shops have been always normal, ordinary. And for me, cannabis and alcohol have never been different. The only difference back in the days is that you had to be 18 to consume cannabis, because the age limit for alcohol was 16. And just in case you're wondering, I don't drink, I don't smoke, anything. I work in strategy, policy, and law, and what I didn't understood for a really long time is how unusual the position of the coffee shop really was. They exist in a legal twilight, visible and embedded in the city, yet only tolerated, operating under a cloud full of stigma. And I never truly understood how powerful the stigma actually was until my own mother got sick. In 2019, my mother got diagnosed with an aggressive brain tumor, and the prognosis was really bad. She was not going to recover. One of the first things I did was research if we could get access to cannabis oil, because we heard many hopeful stories. And I was really happy that we could get it for her, but she was too afraid to try it. And more than that, she also didn't want anyone to know that we had it in the house. Not her doctor, not our family, not her friends. Because it was drugs, she said. And then I understood that the stigma was actually bigger than her chance on relief. She went through 6 months of chemotherapy and 50 sessions of radiation, but the tumors came back. It didn't help. But that was also the moment that she dared to try the cannabis oil. And what I saw was unforgettable. She ate, she slept, and her quality of life improved. But it was too late to change the outcome, and she passed away just a few weeks after. And that's what stigma truly cost. My mom waited till the very end to get some relief. Not because of lack of access or lack of knowledge, but because of stigma. And actually, that was also the moment that I realized that no one should ever have to choose between care and acceptance. More recently, my aunt reached out to me. She has Parkinson's disease and she has pain every single day. And she tried everything, but nothing really helped. She knew about the story of my mother. And she also heard positive stories about cannabis oil as an additional treatment for Parkinson's disease. But she did what anyone would do. she went to her doctor and she asked for help. But the doctor didn't want to prescribe cannabis. Not because there was no evidence or medical reason, but because he didn't want it. See, even nowadays, cannabis of pharmaceutical quality is available in the Dutch pharmacies, stigma still grips the medical system. But what do you do as a patient in need? I can tell you what my aunt did. Out of desperation, she went to the coffee shop and she asked for a joint. But coffee shops are hospitality. They're not a place to seek for medical help. They're not pharmacies, not pain management centers, not clinics. And still, patients like my aunt are pushed there. And that's the core of the problem. The patients are not acknowledged, not guided, and once again, the choice appears, care or acceptance, but never both. This doesn't just happen to patients like my mother or my aunt. The Medusa research of 2024 revealed the profile of the medical cannabis patients in the Netherlands. 2/3 are women, and more than half are over the age of 50. These are not experimenting teenagers. These are ordinary women, like my mother, like aunts, neighbors, you. Ordinary women who want nothing else than the right help and care. Don't we all deserve that? The research also revealed that the majority of the medical cannabis patients are not getting the right help and care. Instead of that, they go to the internet, to friends, or to the local coffee shop. The point is that medical and recreational cannabis are different. Medical cannabis is a medicine. It requires strict pharmaceutical standards, dosage, purity, oversight. It belongs in healthcare with doctors and pharmacies. Recreational cannabis is different. It's a consumer good. It's a product for enjoyment. And over the years, the coffee shop have been professionalized, but always in favor as their purpose. The purpose in public order. But both systems, they have their place. But if we blur the lines, we fuel the stigma. And when stigma wins, patients like my mother and my aunt lose. Yes, you might be thinking there are bigger problems in the world. Poverty, war. But if we look at Ukraine, they took a huge step in the middle of the war. They legalized medical cannabis for pain relief, for people who are suffering from severe pain every day. But something essential was left out. PTSD. It's not on the recognized conditions for medical cannabis. Also here, once again, we show that stigma won over care. Let me make this concrete. Walk into a drugstore today. Ask for paracetamol or for melatonin. Nobody's blinking, nobody's questioning you. But ask your doctor for cannabis oil for pain or for sleep. The conversation changes instantly. The atmosphere changes. You're not longer seen as a patient, but as somebody who might have a problem. If we think about it, we seem to be stuck in a weird paradox. Medical cannabis is legalized on paper, yet out of reach for too many patients, while recreational cannabis is accessible, but only tolerated. Is it this time that we finish what we began? To move from tolerance to regulation and from stigma to access? Unfinished solutions are not enough. Because this is not about cannabis, this is about freedom. The freedom to drink alcohol or to consume cannabis. To take paracetamol or cannabis oil for pain relief. And that's why I stand here today in Amsterdam, the so-called city of freedom, to ask you to look beyond the stigma. Let's create systems that function as they should. So no one ever has to choose between care and acceptance.